Hi, I'm Dr. Nicole Alexander Scott, Director of the Rhode Island Department of Health. This video is about opioid pain medication, as well as some non-opioid options that may help you manage your pain. The goal is for you and your healthcare provider to make an informed decision together about the safest, most effective way to treat your pain as your body heals. Being informed about opioid medications means understanding a few basic facts. As you might know, opioids are a type of medicine used to relieve pain. Some of the common names are Vicodin, Percocet, and OxyContin. They are powerful, highly addictive drugs that have the potential to cause long-term dependence. In the last few years, we've seen more and more people in Rhode Island and across the country become dependent on prescription opioids. Tragically, this has resulted in an extremely high number of overdoses and preventable deaths. One important thing to understand about opioids is that they do not treat the health issue that is causing you to have pain. What they do is cause your brain to block the feelings of pain. For this reason, opioids are very addictive, and even in low doses, or even in short durations. If you're dependent on an opioid, you will feel sick if you suddenly stop taking the medication. You may have nausea, vomiting, and diarrhea, or you will feel restless and agitated because your body may be in withdrawal. A dose of opioids that is too high can make someone feel too tired to drive or can cause you to stop breathing. When you stop breathing because of opioids, that's an overdose. An overdose can happen to anyone. If you're taking opioids and anti-anxiety medications or sedating medications like Xanax or Ativan, you are increasing your chances of experiencing an overdose. Drinking alcohol while taking opioid pain medication also increases your chances of experiencing an accidental overdose. It's important to talk to your healthcare provider about the roles that alcohol, illegal drugs, or prescription drugs have played in your life. These conversations are not in any way about judgment. They're just about making sure that you're getting the most appropriate medication to help manage your pain. Opioids are the right medicine for certain people in certain situations. But for lots of other people, there are other ways to manage pain much more safely and much more effectively. Some of these non-opioid options include ibuprofen, which is the medical name for Advil and Motrin, or acetaminophen, which is the medical name for Tylenol. Other non-opioid options are physical therapy, chiropractic care, and acupuncture. During your healing process, you should not expect to be completely pain-free. In some ways, pain could be actually healthy. It's our body's way of telling us how we're healing.
So Abby, let's talk about the safest and most effective way to treat the pain from your recent injury. How does that sound?
I feel like the pain isn't going away as fast as I hoped it would, and I can't do the things that I want to do. It starts in the afternoon and it gets really uncomfortable into the evening.
So pain is a normal, natural signal from our body to tell us and can help guide us in our healing. We can't expect to be pain-free when we have an injury. It's important to listen to your body as it heals. Let's review some options that will help you manage your pain. Some very effective first-line options to manage your pain involve common non-prescription pain medications like ibuprofen, Motrin, Tylenol. They have little or no side effects and are not habit-forming. You might want to also consider combining these non-prescription medications with physical therapy, chiropractic care, and/or massage. And if you develop chronic pain, some counseling can be helpful. It's been found that by combining these therapies, people with injuries can heal and return to normal daily activities even faster.
They sound really promising, and I like the idea of having a medication that doesn't have side effects. What are my other options?
You might have also heard about prescription opioids and how they are a type of medicine to help relieve pain. This part of our conversation is really important, and I want to make sure that you are fully informed about this type of medication before making any decisions. What are some of the things that you've heard about opioids?
I've heard they're really strong drugs, but do they treat my injury?
That's right. They are very powerful. They block the feelings of pain, but don't actually help with the healing process.
I've also heard that some people get addicted to them. What makes them so addictive?
Most people who take an opioid for a short time will not become addicted. However, some people develop addiction, and that means they need to continue using the opioid despite adverse consequences. That's why we need to be very careful about prescribing and starting these medications. Now, people who take medications for more than days to weeks develop tolerance. That means they'll need a higher and higher dose to get the same effect.
That sounds serious. Are there other side effects?
Some other side effects to think about are the symptoms of withdrawal. When people stop taking opioids abruptly after they've developed some tolerance, they develop a horrible feeling of nausea, vomiting, and just pain, diffuse pain, agitation, anxiety. This type of medicine should never be shared. This medicine must be stored in a safe, secure place, preferably locked, where no one else can access them. Unused opioids need to be thrown away as soon as they are no longer needed. You can dispose of them by mixing them with kitty litter or coffee grounds and throwing them in the trash, by bringing them to a drop-off place, perhaps at a police station, or by even just flushing them in the toilet.
I actually knew someone who overdosed on their prescription opioids.
Opioids affect the ability to breathe normally. Too high a dose can cause a person to stop breathing. This is an overdose, and it can lead to coma or even death. Overdose can happen to anyone. Prescription opioids have side effects. A patient might become dependent, meaning they have a need for the opioid, or they go into withdrawal. An opioid will make someone drowsy and can affect their ability to think clearly or operate any type of motorized vehicle. Naloxone is the antidote to an overdose. If you are at risk for an overdose, it is essential to have this drug on hand at all times and make sure your friends and family know where it is and how to use it.
If you're a patient who's experiencing pain, it's important to speak to your healthcare provider about the treatment options that are best for you. Feel empowered to ask questions and speak your mind about concerns. If you feel that prescription opioids are not the right option for treating your pain, tell your provider. Here are 4 questions to keep in mind while talking with your provider about pain management options. What are the side effects of taking opioid prescriptions? How do opioids treat my injury? What are other effective opioid-free options that are available to me? What are the health risks that apply to me based on my personal and medical history? The role of a patient seeking help to manage pain is something that's familiar to me. My first exposure to Vicodin was at 14 years old following a gymnastics injury. It was prescribed by my family physician and monitored by my mother. What happened next, it seemed no one could have predicted. I felt a switch flip on inside me. My life quickly spiraled out of control. By the time I was 19, I was an IV heroin user. In September of 2012, I overdosed on heroin. Naloxone saved my life. Since that day, almost 6 years ago, I have seen and experienced the fact that recovery is possible. If you're considering options for managing pain, be sure to speak with your healthcare provider about any concerns you may have about how alcohol, street drugs, or prescription drugs have played a role in your life.
And remember, if you have a question, your doctor is here to answer it, so don't hesitate. There's no judgment. Thank you for watching this patient safety video, and thank you for being an informed, engaged participant in these important conversations about your healing and your health.